Okay, and this will be our last lecture. And it's very simply, it's going to be on, we're going to talk about burns. We're going to talk about two burns right now. Favorite type of burns are sunburn, yippee. And the other one is going to be where you actually burn yourself, stick your hand in a fire. Okay? This is going to be quite straightforward. Hopefully should be quite easy. So, I'm not going to go through it too deeply, but you need to know the structures of the skin, different layers, okay? I believe I have given you this as part of the structures. You can go onto any YouTube and pull up structures of the skin, but remember the layers because you need to know this for the classification of the burn. Also, I will not go through it, read this please and understand it. The melanocytes, okay, they're found in the deepest layer of the skin and in the epidermis. They produce your melanin. This is where people want to get a tan. This is where melanin creates it. The only problem to do this is that we're going to see as we get forward here is that the melanin will provide a UV shield, but the problem is that at that layer, okay, the lever of where your melanocytes are, this is where your DNA is for your skin. So to tan, you have to send radiation to the deepest layers of your skin, which unfortunately causes this sort of damage, which means that you will get skin cancer. Keratocytes, these are down up in the epidermis. Okay, make note of these ones as well. Read this section in here. Make sure you understand it as you're going forward in this lecture. And they are at the surface of the skin. This is what gives you dry, flaky skin. Okay, this is what usually ends up falling off. Langerhans cells, these are dendritic cells. These are part of, and where they're important is they are part of the immune cells of the skin and mucosa. They help repair your damaged skin. And here's another nice thing. So we've taken your skin and done a cross section, and here are your different levels of skin. Here's your epidermis, which encompasses everything from your keratocytes all the way down to here to the stratum basale, and then there is the dermis underneath. Okay, the dermis has one layer. Okay, and the epidermis is composed of 1, 2, 3, 4 layers. Okay, so you see here where these melanocytes are all the way down into the basis of almost the dermis, right? And look where they do. They send these little. This is what I find cool about this little diagram here, is it sends out these little areas here to produce melanin. When melanin is produced, the little dots are the melanin, and those melanin help to try and protect these areas in here from actually the UV light that you're getting. So a tan is actually not your body going, hey, look how good I am. Your tan is like, this idiot has been out in the sun too much and is going to continue to be out in the sun too much, and we're trying to protect our damn DNA by making melanin. So a tan is not a thing of health. A tan is your body saying, your brain is stupid and you're spending too much time in the sun and we have to protect ourselves. That's basically what it's doing, okay? So let's move on here. We talk about ultraviolet radiation, and the reason why we're teaching you guys about sunburns, you're like, isn't this a little bit pathetic for teaching in pathology? Well, this is a big deal these days, okay? If I was in lecture right now and you were looking at me, I would tell you, pick out where my skin cancer was on my face, okay? I have had skin cancer on my face, okay? Not because I did not use sunscreen when I was younger and growing up. I just had a spot that I didn't always get very often, and guess where it was? Right under my sunglasses, right at the spot where the bridge of my nose touches my sunglasses, and the sunglasses would always wipe off the sunscreen on that area of my nose, and guess what? That's the area that always seemed to get burned. Okay, I was being good, I was trying to do it, but I got sun there, and what happened? Fortunately, I ended up getting skin cancer there. The non-malignant form, but I still ended up getting sun cancer. I ended up getting cancer from a sunburn. So what we're looking at right here is we're looking at ultraviolet radiation. The sun is radiation, okay? When you like the nice sunny weather, well, it's radiation, all right? There are 3 types, and you need to know about these because this is how sunscreens are judged, okay? There's UAV, long wavelength radiation. There's something called UVB, medium wavelength radiation, and we have something called short wavelength radiation, okay? The longer the wavelength, the more penetrating power it has. like this. Long wavelengths, okay? A long wavelength is, and what a wavelength is it's from here. I'm actually here now. Okay, no, this is good that I'm actually doing this lecture like this right now, because I can use the little pen here. So let's do the following: a wavelength. Okay, and this is, I won't get into this much detail on your test, so just relax and just listen to the nice calming sounds of my voice. A wavelength is the following. Oh god, I can't even draw straight right now. Okay, so I'm going to draw another. This is what a wavelength is, and if you hear my children yapping in the background, sorry, but they're noisy as hell. A wavelength is the following. Okay, a wavelength is this. That is one wavelength. Okay, a wavelength is from here up to one point, and then its oscillation back down through and to the point where it comes to zero. That is a wavelength. Okay, and you measure that wavelength by the distance from one point to another. I know this is simple math, okay, but that's it. The distance between here and here through that one oscillation is a wavelength. If I have another wavelength that is shorter than this, then that means that it's going to oscillate quicker. This wavelength here only goes from there to there, right? All right, now let's get my pointer back here for a second. This wavelength, this arrow from this point to this point, is shorter than this one to this one. That's it. That's all wavelength means. So if you look up here at this point here, one wavelength is from here all the way up through one oscillation up to the other oscillation down to the point where it ends up, boom. The wavelength is from there to there. So that's what a long wavelength is. This one has a shorter wavelength. It's a medium wavelength. Okay, there to there, and then I'm done. Right there. Shorter wavelength. Okay? This wavelength only went this far, this one here. So that's what they mean by wavelength, and that's why the scribble here is important. Okay, it's a visual cue for you. The more higher the bumps and the more closer the bumps are together, shorter wavelength. The longer the distance between the two bumps, okay, distance between the bump is a longer wavelength. The long wavelength of UVA penetrates much deeper. Okay, it has more energy. It nails itself right down through your from your dermis. This is actually incorrect right here. Your epidermis should be up here, and your dermis should be down here. Excuse me about that. I don't know why that diagram is a little off there. But dermis is below and epidermis is above. So this goes all the way through. Okay, this goes all the way through, and for those of you who did not understand what I just did, okay, swap these two. This is up here, this is your epidermis up here, and your dermis is below, so dermis should be down here. This is one error in my diagram. So the UVA penetrates all the way down through the epidermis, through the dermis, okay, even goes as far as the hypodermis. So this is where it gets down to where your DNA is. Remember, your skin is growing from the bottom up, okay? UVA, and we say that the UVA causes indirect damage to your skin. Why? Because you do not feel the damage right away. You feel it 20 years later when the DNA has been screwed up by the UVA. So UVA makes up 95% of solar radiation that reaches us. The UVA penetrates far into those deep layers because it's a low wavelength. It affects the dermis. It affects cells in the dermis without producing which reacts by producing less high quality collagen and elastin fibers. So this is what dries your skin out. Becomes wrinkle. You get premature aging. Does not cause a sunburn. It's not the burning effect that you will immediately acutely feel from a burn. a sunburn. That is UVA causes. It damages vitamin A, it damages your immunity, it damages your DNA. You will get long-term damage from UVA. This is the stuff that causes premature aging of your skin. This is what will cause cancer of your skin. UVA. Indirect damage, you feel it later. Okay? UVB causes the direct burn of the damage. It's that shorter wavelength, it's that medium wavelength radiation, stays in that upper layer, and basically that's what causes the heat and causes the burn. It penetrates as far as the outer layers of the dermis, so it gets to the epi, just to the outer layers of the dermis, not as deep down into the dermis as the UVA. Skin tries to, and this is the interesting thing, the skin tries to defend itself by triggering erythema. Stimulates cells to thicken within 72 hours, activates pigment cells. This is almost like an inflammation reaction that is occurring in your body due to the UVA and the UVB damage. So, and actually it damages vitamin A production and your immunity of those Langerhans cells. That happens as well. Both UVA and UVA both damage Langerhans cells. This one causes direct DNA damage. So this is where you will end up having dead skin that needs to slough off and repair. Okay, so UVB, direct damage, this is where you get all the symptoms of a burn. Okay, and it is almost like an inflammation reaction that is occurring here. The effects of UVC, guess what? Not a damn thing. UVC is such a high wavelength, such a short wavelength that it doesn't even penetrate. And it doesn't even penetrate the outer ozone layers, and therefore it doesn't affect us at all. So you have basically 95% UVA, and you have the other 5% is UVB. And that 5% UVB is going to cause the indirect burn that is going to, or it's going to cause the direct burn that's going to cause you pain. And that UVA is going to age you and give you skin cancer 20 years later. The general effects, and having said that, I know I've said that tongue-in-cheek right now, but it's going to cause cancer 20 years later. If you want to do something right now and see that how serious this is for healthcare, go to Google, type in the tanning sites regulation for Ontario. Nobody under the age, I think it's 18, it could be wrong, could be 21, but no child under the age of 18 is allowed to enter a tanning salon and use a tanning bed. It is illegal. You can actually get charged and possibly jail time for doing that to a child, to anybody under the age of 18. It's like selling alcohol to somebody under the age of 18. Okay? There are cases where a child who was 16, 17 or whatever, she wanted to tan, she kept going to these tanning salons, and which one of these two UVA or UVB stimulates the tan? It's the UVA. Which one also causes the DNA damage? UVA. Okay? Melanocytes are stimulated by the UVA. The UVA causes long-term damage. Those are my kids screaming in the background again. And what ends up happening is there was this one girl who ended up actually, by the time she was 21, ended up having skin cancer all over her body from overuse of tanning salons in Ontario, which is why there is the law right now. Okay? Okay. So the sunburn, as we see, occurs immediately due to that heat load that usually happens within that, from that UVB radiation. The tan, as we said, is where we end up with that small doses of UVA produce what we call transient and immediate darkening of the skin, which usually fades within hours. The higher doses produce pigment changes, and that's that for those melanocytes, and that is what everybody wants to go for. Want to go for the tan. But so both pigmentation is induced by both UVA and UVB. Okay, based by those melanocytes, we see that UVA probably contributes to it more. And what ends up happening is that we end up getting that melanin gets translated to those keranocytes, and that's where you get your tan. But unfortunately, to get a tan, as I said, a tan is your body going, holy crap, we don't want to be exposed to this UVA and UVB stuff. It's causing damage. Let's produce melanocytes. So a tan is your body's response to you being stupid. I know I'm pissing somebody off right now by calling people who tan stupid, but that's the way it is. I like to say that, and here's a little offside here, during the summertime, and people come up to me and I'm paddling and doing stuff, and I have to change shirts because I'm wet, and people go, "Oh my God, you're so white." And I say, "I may be white, but I'm cancer-free. How about you?" So I know if you see me and I'm pasty white in the summer, ha 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 ha, I'm not going to get old. So if we see how this process occurs, ultraviolet radiation, specifically the UVA and its friend the UVB, hits the melanocytes. Some UV reaches the lower skin layers. We see immune cells getting damaged. We see DNA getting damaged. We see inflammatory mediators being released. You got a sunburn. Okay? If you don't get too much, if you don't overdo it, so this section right here this is where you overdo it. Okay? Over here, this is where you get your tan. So you notice how much is too much for each person? Well, there's no hard, fast rule, right? So, and you don't get tanned right away. You have to be out in the sun a lot, and this is where the tanning occurs. So, do you really want to take the chance of creating, is it 10 minutes? Is it 5 minutes? Is it 20 minutes? Is that the difference between just getting a tan over here and creating skin damage and a burn? Tell you what, I don't want to take that chance if it means that when I'm 40 or 50, you have to cut huge big swaths of skin off of me because I have cancer, or that cancer is malignant and it's now gone to my chest and everything else. Don't take the chance. It's not worth it. Okay? It's like driving down the road. It's like trying to go westbound into the 401 down the eastbound lanes. You're taking a chance, a very big chance of hitting a car. You have a very small margin. So this is why we say just don't tan. Okay? But look at what's very interesting here. We get immune cell damage. So you damage your immune system. A large part of your skin, the largest organ of your body is your skin. A large part of your immunity is through your skin as well. You have damage there. You have that DNA damage that will hit you 20 years later. You have inflammatory mediators released, like an inflammation reaction. That's your body's response. So a sunburn is more an inflammation reaction than it is anything else. That's kind of important, and we'll talk about why in a little bit. So prevention, sunscreens. You guys know all this. Use sunscreens, and what they're chemically soluble and physically insoluble. Chemically soluble basically means that it's a soluble thing that you can actually see through. Physically insoluble, that's the zinc stuff that's like white, okay, that you can see. So chemically soluble means that you can see through the sunscreen. This one means you can't see the sunscreen. Basically sunscreen. Chemical agents, they're chemical agents. They protect the skin from those UVA and UVBs. They basically reflect that sunlight off of you. And we say that the factor, or the sun protection factor, that's what SPF stands for, is its ability to obstruct UV radiation. And we know from that, since we don't get UVC, it's only UVA and UVB. But there's a scale of 1 to 30. Higher than 30 means that you basically get greater blocking UV radiation of the sun. There's many controversies right now on whether or not 50 or 70 or 80 UV block is any better than getting a 30. Okay, get 30 or 30 plus, and you'll be fine. The biggest mistake people do is they don't reapply. Okay, because sunscreen will wear off. Sunburn is caused by the excessive radiation to those lower layers of the skin, causes an erythematous inflammation reaction. So in a couple of slides now I've said inflammation reaction. So a sunburn is really not a burn. It's not like I'm setting you on fire, but it is an inflammation reaction to damage from UV and UVB radiation. Specifically, the UVB radiation is what it is reacting to. Symptoms include varying degrees of skin redness, continues for about 24 to 72 hours, causes scaling, peeling 3 to 8 days, and continue for several weeks. Severe sunburns, we end up sometimes getting blistering, weakness, chills, fever, and malaise, and pain, and very severe ones. And this girl has very bad sunburn. That's a pretty good one, isn't it? And you can see the difference between it. So this is all inflammatory reaction. Okay, from too much UVB and UVA. If it gets really, really bad, as some of you might know, it might blister off. Okay, and so here's her whole sunburn, and this part here is actually blistering. A couple of days later, after the blisters pop and everything, and your body's healing, then that dead skin is going to peel off. Okay. Treatment of sunburns. Mild to moderate sunburns you treat with anti-inflammatory medications like aspirin, ibuprofen. Oh, cool. So you use anti-inflammatories, okay, for a sunburn because it's an anti-inflammatory. So this is where I would say, if your choice is Tylenol or your choice is ibuprofen, you want to choose the ibuprofen because of the anti-inflammatory, because of the anti-inflammatory effects it has. Excuse me. Cold compresses and cool baths and moisturizers help to help the skin. Sometimes they will use steroid or non-steroidal agents, can be used depending on the severity of the burn. You can get like minor steroid creams in over the counter. Blisters should not be broken. The reason being is that it actually helps to preserve it. It makes a protective layer on the skin that is there, and actually helps. By breaking them, then you actually hasten the healing process. Or sorry, by leaving them intact, you speed up the healing process. If you break them, you will slow down the healing process. The one thing that can happen as well is we can get something which is called a drug-induced photosensitivity. So this is where, hey, you know what? I wasn't outside for. You can go outside for 5 minutes. It's a sunny day. Say it's Wednesday and you're studying for pathology and it's a sunny day out because we're in spring right now, and you're like, you know what, I really just need to go and sit outside for 5 to 10 minutes and get some sun. Now, 5 to 10 minutes should not cause a sunburn, unless you've taken a medication that makes you photosensitive to it. So you can get and photosensitivity basically is where drugs will create an aggravated response to UV radiation, and this is what UVR means. Ultraviolet radiation, and specifically when we're talking about UVA and UVB. Okay? And it's taken in when you have combination with that sun exposure, even for some very small moments of time, you can actually end up having burns. So this is where people are on erythromycin, sulfonamide medications, Benadryl. We talked about that in pharmacology. Okay, sulfonamide agents means that you cannot stay out in the sun at very long at all. Same with use of Benadryl. Some antipsychotics, some diuretics, hypoglycemic agents, and we say that those hypoglycemic agents can be sulfonamide based. Okay, so you could even say that some anti-infective or antibiotic agents that have sulfonamides, and then what I would do here is hypoglycemic agents for type 2 diabetes, put in brackets here, sulfonamides as well, and some anti-inflammatory drugs that you use for a sunburn, like naproxen, can make you photosensitive as well. Now, that was sunburns. Now we get into thermal injuries. Okay, 1.2 million people in the U.S. a year, and these facts are about from 2010, so it's probably about the same or larger. 1.2 million people burn themselves every year. Okay, we're not talking sunburns. 51,000 of them require hospitalization. 30 to 40% of them are children under the age of 15, and sometimes the average of these kids is 32 months of age. Flame burns they're flame burns from direct exposure to fire, and then most commonly afterwards is scald burns, where people pour themselves. And I would say number one on the hit parade that I see in the emergency room at sick kids, scald burns. And it's usually mommy or daddy who pick up the child in the middle of the night. And I know right now somebody in the room is going, oh my God, I've done this, and he's going to make fun of me. No. This is what happens. This is the creative thinking. Parents think that they can drink a hot cup of tea in the middle of the night at 2 a.m. in the morning while holding a baby in their arm. No, you can't. Okay? Because the kid is going to go, ah, and reach for it, and then pull it onto themselves. And then ends up what happening is you've now scalded your child, and you're feeling guilty as hell for the rest of your life. Okay? And then you try to make up for that burn that you did to that kid for the next 15 years, and you end up spoiling them all to hell. So don't do it. So it's usually, but what that tells you is it's usually not due to being malicious. It's usually due to being careless. A lot of these burns are due to being careless. Okay, thermal injury, as we said. So we're talking about direct burning of the skin with actual heat. Vital and essential function of the skin is protection of the body. So by burning the skin and damaging that skin, you are opening the skin up to infection. The number one thing it does, the number one risk of a burn, is predisposes the area for infection, microorganisms. Number one risk, infection afterwards. Immediately, number one risk too is massive loss of body fluids and contents, because think back to that wound healing. You now have fluid, you now have things rushing to that area to try to, you end up losing fluids massively through that burn. The skin, by also doing, you interfere with temperature regulation, and it also puts a very, very high demand on the metabolic processes of the body to try and repair it. So there are these four things that are key. Oh gee, I wonder if I'd ask you that on a test. Four things that that the loss of skin tissue from burns leads you at risk to: microorganisms, loss of fluid, temperature regulation, and high demands for metabolic repair. Classifications: first, second, and third. Everybody's heard of first, second, and third. You're going to have to know a little bit more detail for the test. First degree burns, there's only one subcategory of first degree burns. There's only one category for third degree burns. Second degree burns, we will say there's a partial thickness or full thickness of a second degree burn. And we'll explain that in a couple of slides. First degree burns, top layer of the skin. Simple. Superficial means superficial, top layer. Okay. Sunburn, superficial burn. Okay. Involves outer layers of the epidermis. You end up getting pink, dry, painful, no blister. Here is a big way of telling one burn from another. No blister in the first degree burn. And in this way, the skin also maintains all its functional abilities. So that previous slide where I said all the functions of the skin were being damaged, those four things that were damaged. In a first degree burn, you don't end up having to worry about microorganisms. You don't have to worry about massive fluid loss. You don't have to worry about metabolic needs. You don't have to worry about you don't have to worry about any of that. Maintains all its functional abilities. So if I throw a multiple choice question at you, and one of the answers says, in a first degree burn, there is massive fluid loss, the answer is no. Okay? Doesn't do that. Pain relief from this is usually due to taking some ibuprofen and maintain some adequate fluid intake and use some barrier creams. Okay? So look at this. This is normal healthy skin right here. Okay? First degree burn, just the top layer. Okay, the epidermis, top layer, that's it. Okay, everything stays intact. Second degree burns involve two layers. They involve the epidermis, and it's going to start going into the dermis. A second degree, and this is where partial and full thickness occurs. If you have a full thickness, it involves all of the dermis. Okay? If you have, because the dermis is a pretty thick layer, so if you have a second degree partial thickness, it's penetrated into the dermis but not gone all the way through the dermis. If you have a second degree full thickness, you have gone and you encompass the epidermis and the entire thickness of the dermis. It is that simple. Okay? So second degree partial involves the dermis and a varying degree of the dermis but not all of it. It's painful, it's red, it's moist, blister. Now you get the blister. Okay, with a partial or a full thickness, you will get a blister. Blisters prevent the loss of water and superficial dermal cells. Okay, it serves as a bandage, which is why they say if it blisters, don't pop it. Okay, you see blister, second degree. Burns heal within about 1 to 2 weeks. Okay, and here we see, okay, here's a second degree burn, and here is what it's going to look like. Now we're going to talk about, notice, in this one right here, the second degree burn is penetrating into the dermis. It's a full thickness, it will start to go it will go almost all the way and involve the entire dermis. We are now going to talk about a third degree burn, okay? And this one is nasty. Look at the difference here. Do you see this picture right here? You still have a lot of the components of the skin layer of the dermis still here and are surrounding it, right? Right? And even down to here. Third degree burn, charring. Okay, you barbecued yourself at this point, and it goes all the way down through the dermis into the subcutaneous layer. Okay, if I were to show you this on a test, I can't. I don't have the the abilities on this to show this on a test, but what do you think this is? Blister and burst, right? Second degree. Okay. Second degree to burns full. Okay, full thickness involves the entire dermis and epidermis. The structures and subcutaneous layer remained intact, such as hair follicles. So we still end up getting some stuff that's remaining intact. Burns are very painful, red mottled. There are sometimes some waxy areas. That is a key thing. Blisters and waxy, blisters and waxy. Blisters appear flat and dry. They require medical care, usually require some hydration, some epithelialization. These take a lot longer, 1 month to deal with. Okay, full thickness, second degree. Partial thickness, okay, less time. Blisters, but didn't have that waxy sort of thing. So if I say somebody, so-and-so has a burn and has a blister, and only a blister, you can say it's second degree partial. If I say it's a blister and a waxy border, then it's going to be second degree full thickness. Okay, look for the delineating things between first and second degree. Okay, as we go to each one, you'll see there's something different on this one that was on the previous slide. Yes, that's a sort of delineation I need you to know for the test. Ooh. But look, okay, there's all that blistering over there, that waxy sort of look. See it? See this area right here, this sort of white area? There's your waxy. That is second degree full thickness. Okay? Ooh. Third degree full. Okay? It's sort of a misnomer saying it's full. Third degree means you burnt it right all the way down to the muscle and the bone. This extends into the subcutaneous, sometimes involving muscle and bone. You've gotten every layer of the skin all the way through, and you've gone to the underlying tissues. It still has that waxy look, but then you'll also get brown and deep red and black coloration to it. Okay? Before Wednesday, throw a piece of steak on the barbecue and look at it. If it looks like a piece of steak that's been barbecued too long, that's a third degree burn. The edema is extensive and it goes into the surrounding area. Here's another big thing here as well. I could even say to you in a question, so-and-so has got a burn and is experiencing absolutely no pain from this burn. What burn could it only be? It could only be a third degree burn, because all the other burns, you have nerve tissue intact. In this one, guess what gets destroyed? Nerve tissue. So if I just say the patient is experiencing no pain from a burn, don't put up your hand and say, there's not enough information to answer this question. Yes, there is. There's only one burn where you experience absolutely no pain from, and that is a third degree burn, because you have killed the nerves. Okay? You've barbecued the steak all the way through. Third degree burns are surrounded, and the thing with third degree is that it's not just one little small area, unless I'm hitting you with a laser. Okay, third degree burns it's almost like a target. You have the middle area, which is the third degree, all the way down through the tissue, and then there's going to be a varying, typically most of the times, there is a varying levels of burns. You go second degree a little bit further out from that periphery, and then you go a little bit further to a first degree burn. It's not like it's third degree with very definitive borders. A third degree burn has borders, and one border or a ring will go around the ring around the third degree area will be second degree, and it will usually be full thickness, and then a partial thickness ring around that, and then a first degree burn around that, and then around that healthy tissue. So it's almost again looking like a target. Okay, the core of that target is third degree burn, and then you have lesser degree of burn going out from that area. That's what it means by third degree burns are surrounded by second degree and third degree burns. This is a third degree burn. Oh, yes, well, pick out where do you think the third degree is? Brown, waxy, completely burned down to, oh, I can see tendon. That must be where all the third degree is. Looking here on the border of the third degree, we see second degree, full thickness will be closer, and then as you go away, second degree partial thickness, and then first degree burns all the way around out to this area over here. Okay, you can see this a little bit. You can see that a little bit better here. this unfortunately is probably a child, and probably, I would say, might even be electrical. Okay, if I'm looking at that, it might even be an electrical burn. And again, here's another third degree burn. Oh, guess where the third degree is? All the black charring area right here. And then moving further away from this burn, we will have second degree burns, full thickness, partial thickness, and then first degree burns out here. Okay? Measuring the extent of a burn, this is basically measuring how much of the body's tissue has been involved in the burn, and the extent is measuring the amount of total surface body area that has been involved, or TSBA, total surface body area. There's a thing called the rules of nines. There's called the London Brower chart. The page numbering I think might be off here because it's a new textbook, but you know what? I expect you just to know there are rules to use. I don't expect you to know how to calculate them. That's up to the physicians to do. The reason why we have to know how much is because the more of your body that is involved in a burn, the more the systemic complications can occur. The more of your surface area that's involved, you can end up getting hemodynamic instability through the loss of. You go back to those four things that I talked about in previous slides. Here are the things that the skin does and why if you damage it. Well, hemodynamic instability, fluid loss, we said will occur from a burn. In severe cases, you can have a lot of fluid loss to the point where a person can lose volumes of fluid. You can end up getting respiratory system dysfunction as well from a burn, because unfortunately what happens from burns, and specifically if it is a fire sort of burn, is you can actually scald the inside of the respiratory tract. Hypermetabolic response, we said that the respiratory system or the metabolic system has to go up and respond. Well, hypermetabolic response, your body can actually shut down and overuse. You can go ketonic because your body is trying to, again, burn more calories than you're actually taking in. And of course, infection. Okay, you get an infection in there, you can go septic and die. The hemodynamic instability, as I said, begins immediately with injury to the cells. You end up getting fluid loss. If it's an extensive amount of your skin, you can lose tons and tons of fluid to the point where you can't drink enough to actually keep in enough fluid. And you can go into shock from this. You'll go hypovolemic, low fluid volume in your blood. And it's usually happening and you can end up getting generalized edema. You can even get pulmonary edema from this, specifically if proteins start to actually enter and cross over into the lungs, into the alveoli. The respiratory system dysfunction, as I said, this is because of these burns, the smoke, and those volatile vapors that come from that smoke can get into your airway, and they can actually damage the alveolar tissue. And then several hours after exposure, you can actually end up getting inflammation occurring as the tissue dies. And those are from those water-soluble gases, and it can be very severe. Okay, and it can also cause, as I said, it can ulcerate the mucous membranes, the lung tissue of the alveoli, and you end up getting pulmonary edema basically from it. Manifestations, as I said, there's usually a hoarseness, drooling, inability to handle secretions, blood gases go, you get a pulmonary edema. You can also get a pulmonary embolism if the damage is so much that you can even get a pneumothorax from this as a secondary complication. All the things we talked about. We talked about respiratory. The hypermetabolic response is because the body is now trying to heal. Okay, it's got to do more healing than it can actually deal with. So increased metabolic, and you have increased nutritional requirements. There's an increased heat production that occurs because your body is going hypermetabolic, almost like having a fever, but your body is trying to interact itself so that it can actually heal. So there's hypermetabolism which occurs, so increased O2 consumption, which means the patient needs extra O2, uses extra glucose, protein, fat. If it doesn't have it, it will use its reserves, and you can end up getting wasting that can happen. Peaks within about 7 to 17 days, and you need hyperalimentation, basically known as you need a lot of calories, constant calories going into the patient, so that they can deliver enough nutrients so that we can prevent breakdown of actual healthy tissue in the use of this. Because the body doesn't have enough body doesn't have enough glucose, proteins, fats by you taking it in by food, then what it will do is it will start to break down healthy tissues to heal. Okay, sepsis. This is basically because you've opened up your body, you've opened up your skin layers and for opportunistic infections to get in. Okay, the bacteria that's on your skin can migrate in. So sepsis, and if that gets into your bloodstream, you create sepsis. You can get a pneumonia. You can get it from pneumonia, from the respiratory issue. You can get it from actually getting into your bloodstream from an infection on the skin. You get UTI infections from being immobile. You name it, you can get an infection, and you can get a sepsis from it. The burn itself is an ideal area for microorganisms because that skin is no longer intact. There's a destruction of those immune components from your skin as well, and you also have protective flora on your body as well. Emergency and long-term treatment of a burn. Well, stop the burn immediately. Okay, this is why we say throw ice on it, cool it. Immediate cooling is usually lukewarm water for about 20 minutes. Medical treatment may be necessary depending on the depth and extent of the burn, extent meaning how much of your body surface has been burned. And hospitalization treatment focuses on maintenance of all those sort of things that were going wrong in the last couple of slides. We make sure you don't get an infection. We make sure you have enough food. We make sure you have enough. Fluid. Okay, all those sort of things are what end up happening when we have hospitalization. End of care, and as well emotional support. The other thing we do with long-term treatment is that we will have skin grafts surgically done as soon as possible, specifically for those areas that have third-degree burns on it, and permanent skin grafts over newly excised tissue. And sometimes there'll be some temporary skin grafts that we use, but basically skin graft is for long-term treatment for areas that have gotten third-degree burns. Now there's a couple of different types of grafts that you can actually do. You can use autografts. Autografts are basically, when you see auto, it means coming from the same person, specifically the person who was burned. So autografts are the best choice because it's your own skin. So basically they slice off some skin from your butt and stick it onto your chest or wherever else you've been burned. Okay. Unfortunately, that means you'll have the hair from your butt on your chest. So, okay. You might, technically then, if you had a burn on your scalp and you took skin from your butt and put it on your head, then you could technically be called a butthead. Ha ha ha. Okay. But the reason why this is best is because there's very little risk of the patient rejecting the skin because it's your own skin. So autografts are the best choice. And usually this is done when there is, and this is another reason why we say that you have to know what amount of the body has been involved in the burn, because autografts might not be available because you might not have enough skin left to do an autograft. They take a piece of the skin from your area and then your body then refills in that area through normal wound healing, and then what they do is they transplant that skin to another area. Hemografts are coming from another human, not the best choice, but if you don't have a lot of skin left, you got to take it from somewhere. Heterografts, and this is when they use it from another species, specifically pig skin. The thickness of these grafts depends on the donor. It also depends on the high level of burn that you actually have. What they will do is when they use a split thickness skin graft includes epidermis and part of the dermis. So this is where they will actually use skin layers from different, they'll go down deeper. Full thickness skin grafts include entire thickness, including the dermal layer. Two-layered synthetic grafts are now actually available. So now for some people, so they're trying to get away from using heterografts and away from using human grafts and everything like this. So there's now synthetic grafts that are used, and it basically gives an area for the body to actually fill in, and it provides a matrix for the fibers to be laid down, and helps with that natural inflammation and healing process that's going on. So the skin attaches to the fibers, allowing that dermal skin to grow. Once the dermal skin has regenerated, then the silicone layer is then removed, and then you can do usually an autograft on top.